Super. Right. Good morning and welcome to this Mummy Star Ask the Expert session. My name is Pete Walrath. I'm the founder and CEO of Mummy Star, and we're joined this morning by three members of the support team, Fiona, Sarah, and Jenny. And our guest speaker this morning is Afni Shah-Hamilton. So welcome, Afni, and thank you for agreeing to give up your time to deliver this session, which I think is really intriguing us as a team. So I'm just going to hand over initially to ask you to introduce yourself and a little bit of background before we head into the actual presentation.
Right, thank you guys, and thanks Pete for inviting me on to talk to you about podiatry and the cancer-related effects of foot issues that can come with it. So I'm going to do a brief introduction of kind of what the presentation is going to go through, and then give you my background about me, if that's all right with you, because that then gives you a bit more of an idea of what I'm about. There we go. Right, so in terms of the objectives, what we're going to do today, it's going to be back to basics, a bit about what is podiatry, because most people are quite confused about what it actually is. Understand the foot-related issues that come about from chemotherapy and radiotherapy, and how podiatrists, we can help you with your general well-being in terms of your feet, but specifically for minimising the impact of the side effects of these cancer treatments. And then I know some of you already put in some questions, so hopefully I'll be able to answer those questions for you. And at this stage, I just need to let you know, while I can't give you individual medical advice, because I need to know things like your medical history, the types of treatment and what's been going on, I can give you some more general overview kind of tips and what awareness things you need to look out for in your feet and your legs, and what podiatrists might be able to do to help you with it. So a bit about myself. So I did my degree at UCL in podiatric medicine, and then set up my private practice clinic in North London called Tiptoe Foot Care. And very early into my career, I specialised into wound care, and then actually started to get private referrals from vascular consultants. So they look at recirculation, and then they pass my details on to the oncology teams, and so started getting oncology referrals. And then since then, I've built upon and investigated more wider extent of all the kind of complications that cancer can do, and how it impacts the feet and the lower limb. And to that extent, I now sit for Macmillan on the AHP advisory board and advise them on podiatry. And I'm also the chief spokesperson for the Institute of Chiropodists and Podiatrists on the side effects of cancer treatments and podiatry. And I wrote a number of articles which you can find out on my website as well. But since then, I've also broadened my training, so I've become more specialised into the pain management side of things as well. And that's because what I find is that you need to have a bigger picture view on how to help my patients, especially those that suffer from complex pain issues. And often clinicians can become quite specialised in a particular area and focus on that particular area of pain, but actually the pain might be coming from elsewhere. And what you find is patients get trapped in the cycle of getting temporary relief from treatment, but it's not addressing the root cause problem. They start getting problems elsewhere. So I'm going to show you just like a little example. So say a patient's got breast cancer and they've had the operation stuff, they often get scar tissue in the breast cancer site. And what happens is the shoulder starts to hike up. As the shoulder hikes up, in order to stay balanced, the head starts to move in that direction. So you already start to get neck and shoulder pain, but actually you start to see how the weight distribution starts to change as well. And so they start getting pressure on one side of the body as well, trying to just keep balance. And that can then put pressure on the hips, the knees and the feet, and you can get that complex pain where you wouldn't have thought that breast cancer tissue site was actually creating all these knock-on effects on movement. So that's kind of where I come into play. And I used a few different things to help that, particularly anatomy and motion, systematic kinesiology and adaptable polarity, but that's in terms of my pain management side. So what is podiatry? Basically, it's the study of everything below the waist. So we look at the back, hips, knees, and predominantly the feet as well. And why is it important? Well, we're constantly on our feet and our legs to get around, and any small problem can actually become quite disruptive to our lifestyle and lead to further complications if not addressed properly. So such as when you're getting that foot pain, it can then change the way you're walking and create other issues. And so while people might go, if they've got a toothache, go see the dentist, or an eye problem, see the optometrist, people often don't realise to either see the podiatrist or see that we actually treat foot problems. And they may go to pharmacy to either save money or not know where to go for help, particularly for something like arch pain. So while they might go and see the pharmacist and think, oh, I'll just get a cream or pick up an insole, well, actually that small foot problem can actually become much more complex. And so just to give you an overview, that picking up that one insole, well, in our clinic, we have 25 different types. And we're looking at things like the shape, the size, the material used, also what's going on with the patient's foot. Is it moving correctly? And we often make adjustments and take into account that also what the patient's lifestyle is and how that foot is moving during that lifestyle. And say, especially as you age, that can change the way you're walking, or if you're going through pregnancies, again, that changes your foot shape. So we always need to keep monitoring these insoles. So rather than just picking up an insole and then just wearing it all the time, that actually has to be monitored every year to make sure that that insole is right for yourself. So that's how you can see how actually just having an insole where you think it's really simple, just sticking it in the shoe, actually creates some other problems elsewhere. One of the most common things is what's the difference between a chiropodist, podiatrist, and a foot health practitioner. So a chiropodist and podiatrist are exactly the same. So internationally, we're known as podiatrists, and it's now become adopted more so in the UK. So we're all known as podiatrists. We have to be trained to degree level, or that training equivalent to degree level, depending on when you graduated. And we're held to both clinical and professional standards, and we're regulated by our professional bodies, which is either the Institute of Chiropodists and Podiatrists or the Royal College of Podiatrists. But we also have government regulations as well. So we have to be bound by the HCPC register. So whenever you're looking for a podiatrist, you need to check whether we're on the register. A foot health practitioner, well, they can have as little as 2 to 6 weeks training. There's no professional bound oversight or standards or regulatory body that they have to be part of, and they're not trained to the same level of expertise. So while they might be great for a quick, simple, like nail cut or something, we strongly recommend you see the podiatrist for anything with more complex issues, particularly patients with cancer, but if you've got diabetes or any other medical conditions, because we have the right expertise and knowledge in this area. So what does podiatry treat? So this is just a brief overview. I've done it into 3 sections. So we briefly just talked about the musculoskeletal. So basically your bones, your joints, your the way you're walking. So we look at the way you walk, look at knee, hip and ankle pain, flat feet, arch pain, sports injuries. Again, providing insoles is one of the things. Dermatology, which is your skin and nail conditions. So some of you may be familiar with seeing podiatrists for fungal nail infections or athlete's foot or verrucas. We actually treat a lot of ingrown toenails, and we can provide surgery for those, particularly a lot of nail deformities, which is affected greatly by cancer patients, corns and hard skin, bunions, cracked heels, but also ulcers and wound care. And that's really important because, especially for cancer patients, because the immune system is weakened as well, you do get a lot more breakdown of wounds and ulcers, but also they react very differently on the foot to the rest of the body. So they've got their own microbiome. So by seeing the practice nurse or the district nurse, often they're not putting the right dressings on those wounds and actually can create further issues. We also look at, which probably people don't realise is just how complex it is, the vascular, which is your blood flow, and neurology, which is nerve and monitoring the nerve sensation as well. Particularly in vascular, we're looking at checking the quality of the arteries in the lower limb, the veins and lymphatic flow. And we use a Doppler, which is a special ultrasound machine that monitors it all. Again, we're looking for, in terms of neurology, the nerves, we're looking for checking for changes to the nerve status. So whether you're getting numbness, abnormal sensation there, for trapped nerve issues. This is particularly important in our diabetic patients because often they get much more of these vascular and neurology problems. And also if we can detect it early enough, we can actually start to do some changes and then speak to the relevant specialist teams about it. So again, this is another area that cancer patients often get affected with, particularly in the neurology side of things. So we've now, in the previous slide, we talked about just kind of where these areas are that we look at, your skin, your nerves, and your walking patterns. Well, cancer treatments side effects in all these areas, and that happens quite regularly on patients, and they constantly are talking about it. Oh, sorry. But one of the most common conditions that I see in my clinic is from chemotherapy in terms of skin and nails is hand-foot syndrome and hand-foot skin reactions. I'm going to go into more details about that in a second, but that can create blistering under the skin and be incredibly painful. Nail toxicities, because there's nail disruption going on, because chemotherapy doesn't just affect fast-growing cells such as the tumor site, they also affect fast-growing cells such as your skin and nails. So we get lots of deformed nail issues, and that can create pain. And again, we've got the neuropathy side of things as well, where you've got that abnormal changes to the nerve sensation. And all of these affect mobility in one way or form. So if you're getting that painful blister, you start to avoid that area of pressure on your foot. That starts to change where you're putting pressure, and can put pressure on the knees and hips and elsewhere. Again, neuropathically, if you can't feel your feet and you're putting abnormal pressure, then you can't feel it, you're going to get the ulceration starting to occur as well. I have put in a bubble nutrition because it indirectly affects patients on cancer treatment, particularly for the neuropathies in terms of the role of B vitamins. Often they have quite low levels of B vitamins and they're not always checked before they start treatment. And actually what we found with the research is that actually improving the B vitamins, you're reducing the severity of neuropathies. And the other area is the mental well-being. And it's understandable that when you're going through chemotherapy or radiotherapy, a lot of the medical focus is on treating the cancer itself. As a result, conditions can be dismissed as they can be incredibly painful and distressing in themselves. And especially when you put it on top of their normal challenges of stress of just going through the treatment and just trying to get through everyday life, such as putting your shoes on and doing that school run, or just being able to stand and wash up, but your feet are too painful, can actually have a real impact on the patient's mental well-being. And I've seen this in my clinic where patients they're in so much pain that they've even considered giving up their chemotherapy treatment because they just can't take it anymore. So being aware of these issues and understanding that they're a side effect of the cancer treatment and they're not just yet another health problem or there's complications from their cancer is hugely important. And there's always having ways to treat and reduce them is literally can be a lifesaver for that patient. Just being able to put their shoes on and just be able to do their normal everyday life is really important. And so by just seeing a podiatrist like myself and getting that right treatment can really make such a difference to the patient. So how can a podiatrist help? So there's a number of ways we can help. So many of you will only probably see the podiatrist if you've got a problem starts to occur or it's when it gets really bad. But I recommend actually seeing a patient at the beginning of their treatment cycle. And that's because if you aren't already doing so, and that's because we can provide practical advice, footwear advice. We're also checking the vascular status, neurology status as well. So again, we're getting that baseline of the foot and what it should be doing. And if there's anything untoward, we can treat all those minor issues before you're starting the treatment. Also, it gives us a good idea of what's going on with your gait, so we can monitor those changes, those neurological changes that are occurring and pick them up quicker. And also in terms of giving you proactive treatment in terms of nails or hard skin. So often if patients have hard skin issues, particularly with one of the chemotherapy side effects of hand, foot and skin reactions, that hard skin can become incredibly painful and develop into ulcerations, that open wound. So again, having that hard skin treated before you start treatment is also really important. And also, I found this just to be generally very beneficial for my long-standing regular patients who then have been diagnosed with cancer. And they actually have found that hugely beneficial that I've put them on the treatment protocol beforehand, so it's actually minimised what's going on with their feet. And also it's that reassurance, right? When something happens, you know who to go to. They know your foot exactly and can actually deal with it and not just, you'll just get over it. Because it's really important to actually have a look at it in detail. So seeing a podiatrist gives you the specialist treatment, reassurance and support for ongoing care. So we're going to look at first radiotherapy. So there's a few things that can happen. The first is in terms of the dermatological, the skin reactions that happen. So patients can often get little swollen red vesicles like blistering on the soles of their feet. That can be incredibly painful. That happens 2 to 3 weeks after a cycle is finished. It can be also get these abnormal areas of hard skin, and that can persist more in long term. So even after they've finished their cancer the treatments. That abnormal dry skin can still have an effect and can be quite irritating for the patient. There's also knock-on impacts on mobility. So often these patients, particularly those who've had any pelvic radiotherapy, will have lymphedema, which is swelling of the limb. And so it's that abnormal swelling that doesn't go down. But because you've got that swelling of those joints, you can't move them as freely. So again, that then also has an impact on the way you're walking, but also particularly between the toes, you start to get open splits between the toes, and that can create these wound infection issues as well. In terms of neurology, there is the radiotherapy-induced neuropathic pain. So again, that abnormal sensation that starts to happen. So by having a podiatrist monitor it, we can actually see whether it's progressing too quickly, and actually then liaise with the oncologist about it as well, of what to do. But it's having that monitoring and being able to check when things are getting too bad. So hand-foot syndrome and hand-foot skin reactions. So with hand-foot syndrome, which is known as HFS, you often get about day 4 after a cycle, and normally it happens after the 3rd or 4th cycle. You get this sudden colour change on your soles of your feet and on the palms of your hands, and it literally looks like on Caucasian skin, so more paler skin tones, like as if you've been stained with bright red paint. But as you can see on the picture below, on the Afro-Caribbean and Asian skin, it looks like more like a bluish ink dye has been put on you, is the skin colour change that happens. And it can be incredibly painful because you get swelling and tightness of the skin, but also that numbness because it's swollen, you can't feel as easily. There's also often related nail issues going on, so nail lifting and curling. And in terms of the hand-foot skin reactions, the reason why it's different is that you get areas of friction, you get these painful hard skin areas that ulcerate. And so it's important to get that looked at as well. And again, with all of them, they affect the way you're walking and your balance, because if you're getting painful areas, you're not going to be able to stay balanced for very long, and that then creates other issues. Why does it happen? It's a really important question. So as we know, chemotherapy affects fast-growing cells. One of them is the keratinocytes, so these are skin cells. And what they found that they think is happening is the chemotherapy drug actually metabolizes in these sites and then starts to leach out a toxin, which then sits on the skin, which gives this reaction. And so because it's leached through sweat glands, which is really, there's a high concentration in your palms and soles, you start to get more of that concentration of the drug sitting on the skin. And so if you can understand why this is happening, at least we can start to understand, well, what reactions are you going to get? And it's up to about, in literature, it's about 60% of patients will suffer from one of these conditions, and particularly those on multi-kinase inhibitors as well. So it's actually quite a big population that can be affected by it. So what are the treatments? So in terms of seeing the podiatrist, we're checking obviously your blood flow and making sure you're walking correctly. And also if you need to get insoles or anything for it, we can give you those. We're checking for the skin condition and sensitivity. So if we can catch that dry skin and some of the reaction issues, we can start to treat that area. Again, we can remove the hard skin and relieve pressure. We can add padding, so we can actually make padding up that actually can apply to the foot to give you that relief. Depending on what the skin condition is going on, we can give you particular types of urea-based creams to help with the dryness, but also it's important to note certain creams will react as well, because you're getting that toxin leaching from the skin. You can't just use just over-the-counter. You need to just have someone assess it, because you can also get a negative reaction as well as a positive reaction to the creams. Again, treat the nail problem. So if there's anything starting to look untoward, such as the nails are starting to curl inwards, we can clear that out. We give footwear advice. So again, things that might be rubbing on the foot. So patients often, when they're having these kind of conditions, will have their footwear will be quite loose and quite slippy, but actually that creates areas of friction. And as we know with the hand-foot skin reactions, areas of friction, you start to build up this painful hard skin. So again, getting the right fitting shoe and the shape of the shoe as well. Some shoes narrow off at the toes, which can cause rubbing on the toe areas. Others are not being held at the heel. And the other one that we can also give you advice on is hosiery, which is basically your socks and what type of socks to wear as well. Because again, you need to make sure that the skin is staying breathable and it's not overly sweaty. So what I always recommend to patients is make sure you're either wearing cotton rich socks, particularly because anything with nylon or synthetic base to them, you're going to sweat more. And if you're sweating more, you're going to leach out more of that toxin, and that's going to react with your skin. So podiatrists can also give you self-care tips. In my clinic, I've actually developed a particular protocol that I put my patients on, which is a frozen sock therapy, and that helps to reduce the severity and delay the reactions of these issues occurring. And again, we give regular treatment. So it's not like seeing a physio where you see them in every week or every 2 weeks. We tend to see, depending on the cycle and what's going on, 6 weeks if there's initial nail problems going on, but it's generally every 2 to 3 months. So that gives us a good time window of what's going on. And obviously, if there's any problems in between, patients can come in and see us between those visits. But it's not like you're seeing us regularly on every weekly basis. So in terms of nail problems, so the nail growth gets distorted, and there's a few things that happen. So one of the most common ones is the lifting of the nails. And if any of you have just been following me on the Rad Chat, I've been putting pictures up of some of the nail conditions that we see. And the nail conditions don't just affect the toenails, they affect the fingernails as well. So don't think that just because you see a podiatrist, they can actually help you with fingernail issues as well, because they react the same. And what happens with these fingernails is they start to lift, but then you actually start to get ulcerations and open wounds underneath, because as the nail lifts, you start to get infections going in, getting trapped, starts to get soggy underneath, starts to break down. And this is where it's really important that you're seeing someone, because we don't want those ulcerations. They can actually get, patients get quite distressed because they suddenly get these areas where in the literature, it looks like they've got a blob of cherry jam under the nail, but it's actually where it's become all red and pussy, and it's incredibly painful, and then it starts to crust up. And I've had patients who've been told, just don't wash your hands, don't do any washing up, because it's so painful. So that's one of the areas that we look at. Ingrown toenails, particularly with things like cytobine, the nails start to become like a pincer effect, so they really start to curl around. And it's not just the big toenails, it's all the little toenails as well. So all those nails start to pinch in, and that can be incredibly painful. Just walking around with it, but also the nail starts to pierce into the skin, again, creates these infections. They're not healing. And because you're immune compromised, you're then more likely to get other severe infections. And especially if you're diabetic as well, which 50% of cancer patients are, it's a recipe for disaster. So getting those areas treated quickly is really important. And in terms of ingrown toenails, we can do nail surgery, but also we can do things like packing the nail to actually widen up the nail so it doesn't create problems. One of the long-term side effects is the nails become thicker. And so again, that creates pressure, especially when you're putting your shoes on, because you're then having areas where you've got these really thick nails. So it's not like a little bit of thickening, it's really thick, and they actually create pressure, and that constant pressure breaks down everything underneath. And one of the other unfortunate effects of the side effects is fungal nail infections. We all have skin fungus, but they're opportunistic reactions. So if your nails start to get distorted, the fungal infection starts to infiltrate into the nail bed, and then you get these long-term nail infections. And in terms of what I do, we can do a couple of things. So we clear out the nails and treat the fungal infections, but also for thickened nails and fungal nails, in the long-term kind of side of things, I use something called wild critique. So it's a nail reconstruction that actually makes the nail look great on when you're looking at it, but actually starts to treat it underneath as well. So it's like a gel fake nail, but actually it's got medication inside there to actually help with antifungal properties to start to treat the area. So neuropathy, this is quite a hot topic. So neuropathy is basically nerve problems, and it's there's two types. There's autonomic and the peripheral, which is kind of your sensation loss going on. And so what we're going to look at is the peripheral neuropathy here. So patients might have a range of symptoms. So they can have decreased sensation where they can't feel their feet, or you can get the opposite where it's so painful that it's like a burning, tingling sensation on the feet, and on the hands as well, you can get it. You can get numbness. There's also changes to your foot shape and the way you walk, because if you can't feel, you don't know where you're putting your pressure down. So some patients may have like a more heavy gait, so they're stamping more, and then that actually puts impact on the foot joints, and that starts to distort the way the foot is moving. Also with these patients, particularly in terms of footwear, because they can't feel, they're actually wearing more tighter shaped shoes to try and get that contact feedback point. So again, that starts to distort the shape of their foot as well. You can get the swelling and fluid retention, which can also give that numbness type pain. And you're more likely to suffer from falls and injuries just because you can't feel what the ground is doing. So you're more likely to trip over yourself and things. So in terms of podiatry, what we do is we're monitoring these things. So we monitor things. So the picture you can see there is monitoring light touch. So that's basically the sensation of like a cotton wool over your skin. And we use a monofilament. It doesn't hurt, but it actually, there's a number of dermatomes on the different areas have different nerve innervations. So we're checking all those. We're also looking for sensitivities to hot and cold, which often get lost. So again, patients can't feel the temperature sensation. While you think, oh God, that must be, you know, quite simple to check. Say you're going to the beach and it's hot sand, they won't be able to feel that hot sand is too hot and they can actually get burns on their feet. They can't discriminate between sharp and blunt. So again, you might step on something and not realize and walking along on it, but something sharp's actually infiltrated into your foot, and that creates wound issues as well. We've got the balance things that we're looking at, but we're also looking at the vascular sensation as well. So making sure there's no disruptions to the blood flow to the area. And so I know some of you have been given things like amitriptyline and pregabalin and gabapentin, and sometimes it doesn't work. For my patients, so I can't give you exactly what ones we give you in terms of, but we can prescribe different topical creams and sprays that actually help with some of this neuropathic pain. And in terms of my pain management approach, what I do is, so I use adaptable polarity and anatomy and motion to look at whether there's any other nerve entrapments going on, because it might be peripheral neuropathy as well, but there also may be whether scar contracture and whether the pelvis. So for example, on my little joint, say if your hip is hiked on one side, you start to get a compression actually in the S1 region, and that can create nerve issues as well going down. So I also check general kind of the mechanical side of any nerve issues going on. And what I found is the adaptive polarity seems to really help calm some of these nerve sensations down as well. So that's what I would use in my pain management side of the clinic as well. There's also the role of B vitamins as well. So neuropathic pain particularly, which people don't talk about, is B5. You're not monitored for B5, but B5 is known for helping with nerve pain, especially in the extremities of your hands and feet. And again, in my pain management side, because I do a lot of nutrition work, I can assess the nutrition side of things. So that's where I look at it and why, if you aren't absorbing the B vitamins. So the autonomic side effects, while this is rare, you must be alert to it. So this is my kind of public service announcement to you guys. You're always looking out for difficulty swallowing or chewing, that sudden loss of bladder or bowel control, and also that sudden loss of altered walking pattern or balance issues. So it's not like when you're seeing the podiatrist and we're starting to notice you're limping away and things. This happens suddenly. The other thing to be aware of in terms of not only for yourself, but also your family members as well, is looking for that slurred speech. So if their speech starts to slur, or they're getting that dragging leg, or they're getting splayed fingers, so they can't close their fingers together, or they're struggling to do the buttons up, that needs urgent action. You need to either speak to the GP, the oncology nurse, or the oncologist, particularly if you're having problems swallowing, because that can really start to affect the airways. So if that's happening, need to see someone urgently. Don't ignore it. And again, it's a simple matter of them reviewing the drugs and taking action for it. So just be aware and be mindful that while it's rare, people don't talk about it. These are really important things that will happen suddenly, that it won't be just a gradual thing. So just be mindful to it. So what provisions are there for podiatry? So sadly, in the NHS, it is very limited provisions, and it tends to be focused on diabetic patients. And even then, not all diabetics get to be seen, and there's a postcode lottery involved with, you know, who you might see and what level. But there is also the private practice, so you can see us privately as well. Often, why aren't you getting told about this as well? Well, you don't get told about it is often by the cancer specialist nurse, because they're often focused on treating the cancer at hand, or they just don't have that specialist foot health knowledge or the time to go through these kind of side effects with you. And also they just don't understand the impact of some of these conditions can have. So in terms of seeing a private podiatrist, what I recommend and how you do it. So you can be referred by yourself. You don't need to go to the GP. You can just book yourselves in. It's all self-referral. And how you do it is, what I recommend is check things like reviews and recommendations, asking for recommendations and reviews and looking at the reviews on Google. There's also the Institute of Proptetists and Podiatrists have a list of podiatrists on there, and so does the Royal College of Podiatrists as well. They both have lists. And you can also check them against the HCPC registers as well, which is that government regulation that we have to abide to make sure that we are practicing podiatrists. And what I also recommend personally is ring up the practice that you've chosen, and not just necessarily what's the closest to you or what's the cheapest. Actually ring up and ask questions. So ask questions about their experience of what they can do. Have they had any particular experience of the types of cancer you have, or experience in treating wound care or nail issues? You know, you can then get a feel of whether that practitioner is going to be the right fit for you. And I always recommend that with any of my patients, it's always you're working together as a team. It's not us and them. You have to work together, because it needs both inputs of basically the patient being able to tell you and being comfortable telling you things, but also you being able to keep an eye on that patient and checking for those early signs and that continuity of care. So seeing that same person over and over again, you really get to know their feet properly. And I think that's one of the key things to remember, is actually getting to know how that foot is shaped, or how the healing levels are, you know, and seeing those subtle changes. So a couple of my patients, I'll keep an eye on their moles as well, and then if I've noticed any changes to the moles, straight onto dermatology, get that looked at. So it's getting to know that foot really well. You've got things like the Macmillan website, where I've slowly been increasing the amount of information in terms of what podiatrists do. And you've got my website, Tiptoe Foot Care, which I know Pete and Mummy Stars has linked to my articles. And also there's a patient information on the site as well, so little patient leaflets. My only other thing is, be aware of things like Dr. Google and the chat forms. While there's well-meaning advice out there, they don't specifically know your medical history, and they could actually do more harm than good. So one of the things I often get told is on these chat forums is things like painting your nails with a particular type of dark aubergine nail varnish will help save the nails somehow. And actually what it does, it masks the area, but that area being masked, actually we can't then catch the subtle side effects of infection starting to occur, and they can progress really quickly, and then it can become a much more complex issue to treat. So again, while chat forums are great for support and things and sharing things, but also not one condition fits all. So you might have other medical conditions such as rheumatoid arthritis or diabetes or anemias and things. They all affect your feet in different ways. So again, while for one patient it works well, these Chinese whispers can actually be quite detrimental. So hopefully you guys, it was a lot to take in, so apologies, and I don't think people realize the vast knowledge that podiatry has, but hopefully you have a slight more better awareness and understanding what a podiatrist is and how some of these cancer treatments can lead to foot issues. Some key things to what to look out for, especially for the advisors, you know, if they are starting to see those early signs of hand-foot syndrome or the nail toxicities, what to look out for and what to do, and especially with the autonomic, so those rare effects of like difficulty swallowing, get that treated urgently. Hopefully I've been able to signpost you a little bit about where to go and who to speak to and what kind of questions to ask. And also just remember that as podiatrists, we're here to support you in your cancer treatments. All done for you. So thanks for listening.
No, thank you. It's been really, really eye-opening. And I think while we hear some of this in passing, I think from time to time, but it doesn't come up often, often enough for it necessarily to get the attention that it deserves. But I'm sure, we hear about, certainly with things like, neuropathy, we always hear it in the context of fingers, and we don't necessarily have that conversation or hear it enough about about feet. So it's really good. I'm going to come back onto that in a minute. Yeah. But just to draw attention as well to just something that you mentioned there, if you do follow Rad Chat either on Instagram or Twitter, Afni did a brilliant week of information and videos and throughout last week, and that information is all on the Rad Chat website as well, which is, as a general place to go, it's becoming an encyclopedia of cancer care. It's fantastic. But well, just worth recommending. We'll put a link on these
And
tips
also
on our
there's the
website.
podcast coming out as well, Pete, today. So they've done a full podcast today. So listen to that again. It's quite a lot, and we do rattle through a huge array of titles in there, but it is a really useful one for patients. And also it's accurate information. And that's the key. It's that accurate information about what to expect. And I think mentally, if you know what to expect, you then know where to go. And it's a bit more reassuring for patients as well.
Absolutely. Are we okay to stop the screen share then, so we can see each other and we're sort of asking any questions? And
just bear with me a second while
yeah,
I try and figure it out. There we go.
I'll keep recording if that's okay. So one of the things I wanted to come back to, because this was a question from Rebecca, but also from our colleague Sarah as well last week, because we ended up having a conversation about neuropathy last week, and you mentioned about, I think it was adaptable polarity.
Polarity, yes. So that looks at flow. So flow in terms of the blood vessels. So it's a type of alternative medicine called polarity therapies, and that basically improves flow in terms of the blood flow. It looks at calming the nervous system down. So we basically, best way to describe it is, if any of you have heard of cranial osteopathy, where they place their fingers on your head and they do slowly, very gentle mobilization. You can do that anywhere on the body. So you can go all the way from the head all the way into the legs and everything. And so you place your hand on the body and you very gently manipulate the flow, and it really tends to help. And I have found a huge impact, not just in terms of my neuropathic patients, but patients on hereditary sensory neuro disorders as well. But it really does help with a lot of these patients at just calming the nerves down. And actually, again, some of it might actually be, while you've got neuropathic pain, also just putting where you're having pressure points. So you've got a pressure point here where the obturator canal has, in between the groin, has nerves going through it. You've also got another pressure point here in the knee. You've also got one at the ankle as well. So can you see, by just releasing some of those restrictions, while it might be neuropathic, but just getting that extra blood flow to that area might just also calm down some of that tissue. But also, if you're getting these blockage points, they also run alongside arteries and veins and the lymphatics. So again, if you're getting better movement, can you see how you're reducing the swelling going around those areas? So that also reduces that numbness and pressure tightness from the swelling area. So that also can just be really beneficial. So I think one of the questions was, my neuropathy is more painful in the morning and lasting at night. Well, first in the morning, your feet are swelling. So as you put that first foot down, it's got nowhere for it to go, because throughout the day, you're starting to get that blood flow through. So again, you're getting that pressure points there. And also towards the end of the day, we know that patients will have, you know, if you've had a long walk and things, you notice that you've got swelling in the legs. Again, that will then increase more pain pressure areas. So again, is it neuropathy, or is there also an element of swelling as well? And that's where that blood flow issue and checking on that. So adaptable polarity, I recommend for that. But also in terms of the anatomy and motion side, we can give you very gentle exercises just to help keep those openings as well. So that's really useful as well, because especially for lymphatic flow, it's the muscles contracting also helps push those lymphatic fluid back up to the heart.
Again, just staying on neuropathy, given the debilitating impact we know this does have on people, whether it is, and you know, again, we don't necessarily hear the effects of it that commonly around feet here, but we've heard it from many families over the years. But those things that you should be able to just do, like, you know, buckling a baby's car seat belt and things like that, and people mentally, it really just, it leaves people bereft of, you know, what, because of cracking of the nails, the skin tissue. Is given how impactful it is on day-to-day life, do you think it's seen for the debilitating impact it has on somebody, or does it get cast aside as one of a peripheral, almost in the eyes of the system rather than the person, a lesser impact of cancer, and therefore it doesn't get the attention that it should?
Yeah, it is very much left to the sidelines. So I had patients in terms of foot, but also they get hand stuff. One of my patients was told by the GP in the midst of winter, you know, when it was snowing, oh, well, just wear flip-flops because it's so painful, the neuropathic pain on the patient's foot. So wearing flip-flops in the midst of winter, not the best thing to do, because again, it's dismissed. All these kind of conditions are all dismissed because they're all focusing on getting your cancer and being lucky or alive, which is great, but the impact it has on everyday life, on everyday tasks, such as doing that baby's buckle up, or just being able to pick up something or have a cup of tea, or, you know, all these basic things, it's really is quite debilitating, and it's not talked about. And also, I don't think it's understood the impact, because again, they don't seem to take into account the person's life and actually just everyday life. If you then said to the doctor, well, okay, you can't feel properly and it's so painful to feel, now don't pick up the pen, don't do this, don't do that, suddenly you can really feel. I think especially now we're all talking about, and I know Naman and me were talking about this, this personalized care. It's becoming depersonalized, I think, in a way, because people aren't actually listening to the patient, and the symptoms of what affects the patient isn't necessarily what the clinicians are focusing on. And actually there needs to be a bit more raised awareness about this. So for that patient who had that neuropathic pain, actually she had some joint restrictions, and actually just gentle mobilization really helped reduce that neuropathic pain. But at the end of the session, she was able to put her shoes on. That's a huge difference, you know. Go back to work. It's just this level of, I don't think people realize, if you get foot pain, everyone understands if you've got a toothache, you can't seem to do anything, right? It's unbearable. But actually, if you've got a foot pain, you can't even get out of bed without being in pain. Every single thing you do has an impact. And people just don't seem to understand that feet and hands, actually, they do a hell of a lot compared to your teeth. I know it sounds awful, but it's a much bigger, wider society with it. And also the other problem is neuropathic pain happens across the board, in all the cancers. It's not just if you have breast cancer or if you have ovarian cancer. And because you've got these little pockets across the board, I don't think they're then matched up, because actually if you took that whole cohort together of all those different cancers and everyone experienced neuropathic pain, it's actually a much bigger piece of the pie than actually just the individual cancers.
Can we talk about, again, this isn't a question that has an absolute answer, I know, because it's how long is a piece of string, depending on the individual person, that their treatments and everything. But just given one of the questions that came from Rebecca, and this also came up actually in the conversation that we were having with the team last week, where it came up randomly about seating positions at work. And Sarah mentioned something, is about this, the elongated impact of it, and how it, and whether there is really a start or a finish to this in terms of treatment and how you can offset. Is it more a case long term of how to offset symptoms as opposed to curing symptoms of things like neuropathy? And I'm sticking with that particular. Sorry, yeah. I know we've covered loads, but I think neuropathy was the one that we've had quite a few questions on, and because, like I said, it came up last week.
So the first thing is seeing a podiatrist from the start, because neuropathic pain starts with minor nerve sensation changes going on. So if you can monitor those minor nerve sensation changes, you can flag them up. So again, if you're flagging it up earlier, you can change treatment regimes or reduce the dosage of the particular drug or change it around, or, so if you're monitoring that from the start is really important. So that's the first way to just kind of combat some of these severity. The second thing is, after it does happen, so actually, no, before I say that, so the role of B vitamins, so again, this is my pain management role, this isn't podiatry, has a huge impact on patients, and the literature around B12 particularly and B6 of being given to patients and helping reduce that severity of neuropathy is key. But it's not talked about, and it's not given that often. And often what they found with some of these patients is they're anemic before they even, so particularly B12 is known as pernicious anemia. So we all know about the iron anemias, but there's pernicious anemia, which is B12. And often these patients are deficient in it. They don't get a test for anemias before they start treatment. And then during treatment, when they're doing the regular checks, then they notice that they're getting this B12 anemia, because again, B12 drops when they're going through these treatments. So one of the ways is they give you either B12 supplements or injections and everything, but actually there's a bigger role to nutrition. So B vitamins, all B vitamins help with nerves. So it helps with the nerves and building the nerves and keeping them healthy. And so you need all the B vitamins, but they can only be absorbed with the presence of protein. And one of the things we know, if you're feeling nauseous, what's the first thing that starts to go is protein issues, right? You don't get the right level of protein in your body. So if you've not got the right level of protein, you're not absorbing the right number of the right level of B vitamins as well. So again, possibly what I would do, and in terms of my pain management clinic, I check these things. So I check the gut health, making sure that they're actually absorbing correctly and making sure they're having the right type of proteins and things. But also what you can do during that cycle is just making sure you're consciously eating foods rich in B vitamins. So an easy one is Marmite, rich in B12 and B6, right? Doesn't taste nice, but if you put it in a broth and you're like, use it as a stock cube, really simple, but really nutritious. Again, you can put it as your vegetable broth, you know, so you're sipping it away rather than another area, because it's water soluble B vitamins. The vegetable water after you've made that broccoli or the green beans or something, drinking that, because that's where the vitamins have leached out and into. So while you're thinking you're eating really healthy, the vegetables, when you've boiled them or steamed them, it's actually that water that's got the vitamins. So can you see how that's a really important area? That this is very much pain management. This is not podiatry. This is because I'm like qualified in other areas and I do a lot of gut health work as well. So this is where the B vitamins have a real key role. Should oncologists be looking at it? Yes. Should they do better studies on it? Absolutely. But again, funding and what is funded is very different to what actually patients need. So that's where that is. In terms of the long term, again, it's making sure that you're keeping that movement going, you know, because if you have got neuropathy, you are going to get joint restrictions going on because just the way you're walking as well. So making sure you are at your best gait cycle, shall I say, as you possibly can, but also, yeah, looking at alternative treatments. So there's studies looking at laser treatment helping with neuropathic pain. I personally in my clinic have got lasers. Yes, they do help. Another one is the adaptable polarity stuff. I know there's not as many of us qualified in it. And anatomy and motion. Again, all these different alternative therapies. Acupuncture, we know, has helped a few patients with these neuropathic pain. So that's that kind of long-term maintenance, and maybe it is possibly that you might have to look outside of the medical field and look at the alternative treatments. Sadly, just because I think medicine it's become very narrow in terms of the funding and what's offered on the NHS, and actually what's out there is so much better. And sometimes what I'm finding is sometimes the better research is done outside the NHS than within kind of what's going on. And also they seem to be pockets of studies that no one really talks about and then disseminates to the wider, you know, groups and things. And I see it regularly from GPs not realizing the vast knowledge you have on podiatry to oncologists. And often I regularly, when I'm writing to new oncologists, send them my articles on this is what you should be doing and this is what the side effects and impact it can have. But again, it's that conversation that just needs constantly being raised with, because whatever happens in the foot also happens on the hands.
Yeah. Nothing divides opinion more than the mention of Marmite in a diet. I think it's going to.
I recommend use it as a stock cube rather than just straight on your toast, because that is quite hard to. It's quite an interesting taste, but actually, if you put it in in your soup instead of your stock cube, you don't taste it. You really don't. So yeah, I mean, some people love it, but it's a really simple, easy way that you can say you are having treatments and stuff, and you're going in and out of hospital, having that jar of Marmite in your handbag. Does that make sense? It just gets you. We know hospital food, bless them, probably not the most nutritious at times, and it's the one time you need that good nutrition in you. But I mean, there's a range of, in my clinic, you know, the patients get given a whole list of foods that they should include in their diet and what to look out for and everything. But again, I have to look at the patient, making sure that other areas are working correctly before I just go, here you go, have all these foods. Because again, it's personalized care. Not one thing fits fits all. So yeah.
Are there any over-the-counter products that could help if you're struggling to get those vitamins into your actual diet?
So there's a few companies that provide better quality vitamins. I don't know, am I allowed to name any?
Yeah, there'll be others available, but if there's ones that you know
so
that you've got your patients.
The one I recommend that I tend to go to is Epigenetics. They're a really good company in terms of good quality vitamins and supplements. The other one that I use, just because some of the vitamin companies have fillers in them, and also you're not absorbing the most correct way. So the reason why I use Epigenetics is the wealth of history on it, and I personally have found patients have really benefited from them. The other one that I also use is Cytoplan, which is another company. Both are websites on there, and you can mention my name and they know me very well. So they're probably two companies to look at. The problem with vitamins is so when we look at food, we salivate. So we start to produce the gastric juices. This is very much pain management. This is not podiatry. This is a whole other area. So I have to keep stipulating because it is a very different area. And I know we're going slightly off topic with it. So when you look at food, you stimulate, the amylase in your saliva and all the gastric juices in terms of the stomach acids and everything else. You need those stomach acids and those saliva enzymes to basically break down the vitamins in the food. Does that make sense? And the food as a whole will have not just the vitamins, it will have the fiber or the other content to help absorb that better. So say when you eat egg, it's got all the vitamins in there and it's got the right amount of protein. So it's everything in that one little egg. And so when you eat it, you're getting all of it in the right levels, interacting with each other to be able to absorb it fully. When you look at a vitamin, I don't think I've ever met anyone who's gone, that's really yummy, and gone and started getting those saliva juices. Do you see getting that body ready with those gastric juices to then be able to digest it fully? So that's where there is, so while vitamins are great, also with caution, just your vitamin doesn't necessarily mean you're getting everything you need in it.
Okay. Apart from gums, there's one good way of getting them into kids.
Yes,
they found a way of making them into gummy bears of some kind. It's like, right, we'll try one of these. Okay, while we've still got Afni for another few minutes, are there any other questions that anybody wants to ask, or the questions that have been put to Afni?
There was one about the PIP, wasn't there, Pete? So
yeah, I mean that's where I was kind of going. I think with the question about like, is the debilitating nature of it actually recognised? Because we know how subjective PIP applications are viewed, and that whole conversation about 1 day in 30 is not enough. But when it has these subtle but really impactful effects on people day in, day out, affecting what you covered in that question earlier on about the normal day-to-day activities.
So PIP, so diabetic patients get neuropathy, and there's a few other conditions that give you neuropathy. So rheumatoid arthritis patients, there's a few others. While we can't give you kind of advice about PIP itself and the processes and everything, what you can do if you're seeing a podiatrist regularly is they can write you a supporting letter. So for my patients, I frequently write supporting letters on how debilitating the conditions are and the neuropathic impact it has on why they need to get that disability allowance or, badges and all sorts. So you can ask a podiatrist. So that's another reason why if you've seen a podiatrist regularly, they have your full history so they can give you that supporting statement to be able to make that application. Does that make sense? Because if you've just seen them once, they won't be able to give it to you because you need to have been seen a few times for them to be able to give a proper good history for that application. But we can give you supporting letters, which tends to help a lot, especially from another medical profession going into your supporting documentation.
Okay. Any other questions for Afni while we've got her? I'm conscious we've got a couple of minutes left. If there's anything that we haven't covered as yet, if there's anything you want to ask, then just pop yourself off mute so that you're not talking to a blank screen. We may well have covered everything that had been put to you anyway.
Sorry, it was a lot I covered. I was trying to give you a good breadth of just how the impact happens, and just having that skin condition can actually affect the walking, or the neuropathy can affect. Again, they all work hand in hand. The body works together. So that neuropathic pain, you will get areas of hard skin developing, get those alterations because you can't feel. So does that make sense? There is a very much, they all work hand in hand with each other. You can't do one without the other.
Well, I think sometimes the simplest way of explaining it is the most impactful, and I think the way you illustrated it using the doll that you've got around, breast surgery or surgery, in and around lymph nodes in the neck suddenly impact how you're holding yourself, your hip, and how it travels down. Is I think it's like, I think we had a conversation about this a few months ago about how running injuries, because it's the area I know well, is transference. And you think it's here, but actually it's a totally different part of the body. And you wouldn't for 1 second. I'd say your lay person, if you picked 100 who've been treated for breast cancer or for bowel cancer, are not going to immediately say, well, of course it's the surgery on my upper left. It's going to affect my, issues in my feet or my hands. And that whole physical alignment and the issues that are associated with that and all the nuanced, aspects of it. I think that in itself, I think it's a really key takeaway. And, I think from the questions, that I've asked, have been asked as well, I hope, this has really shone a light on the fact that, it's not just one binary, thing that we're, in terms of, treatment and side effect. It's all the other aspects of it that cross over and things that, some are the short-term versus long-term impacts as well. And I think seeing it as a whole picture rather than that, start to finish treatment surgery, bang, you're boxed off and you're done and everything starts to ease back. We know, all too well, sadly, we hear it and see it every day. The biggest impact is the post treatment and the post surgery. It's not often the bit right in the center of it, because that's when, people are so focused and headlong into getting through that and setting themselves milestones that they don't actually have the time to then sit and actually realize and start to feel those impacts and the bits that really, affect day to day. So this has been fascinating. I think when we first broached this subject a few months ago, it's not one you would think from the outside in, thinking, oh, this will be one where you don't know where to stop talking about, but there's actually so much. And I think, again, I think because we've had more time, with Rad Chat last week. If anybody's watching this back, if you go on Rad Chat's website, you'll be able to look up all of the previous podcasts and all the other information that they have on there. I think he's actually put it up while we've been doing this session, Afni.
I think so, yeah. I know my phone's been pinging, so it definitely has been going on. But it's an area that I've been talking about 18 years of my life. This is, so if I can tell anyone, just share it to as many people, because you don't know, because people also suffer in silence. They don't talk. And if they've been told, oh, it's just a side effect, I'll get over it. It's actually, half the battle is actually going, no, this really does impact my life. And it's okay to say it impacts my life, because they're constantly dismissed, like, oh, well, don't worry about it. I've had so many patients go, oh yes, my family said this, and they've said, oh, just at least you're alive. Well, yeah, that's great. Apart from, what's the point of being alive if I can't do anything? And just the conditions are being so trivialized that they feel embarrassed to even say, I've got this. This really is affecting everything I do. And that mental strain of just holding it in, and knowing where to go with it. And
I think that phrase you just used, I think is key in so much around cancer care, is that those phrases like, well, at least you're alive, but, or at least you're stable, but. It's like, well, the but hides so many ills, and it's the impact. Thank you. That has been, we've been on, it's quite very surprisingly, we've actually been on an hour. So thank you so much for delivering this for us and sharing all of your expertise and all of all these points of contact that we can go to, and we'll have these resources listed when we put this session up. It'll probably be up in the next 5 to 7 days on our website, mummystar.org, and there'll be links in there as well to Afni's papers that she's written, as well as her website, and we'll put links to some of the other resources that have been mentioned in the chat as well. So a thank you from myself and the team, and the many families that will have joined or will be watching this afterwards, and health professionals as well. So if there's any other questions, please do not hesitate to come back to us. Thank you very much, and we'll stop.
Thank you, everybody. Thank you.
Thanks for having me.
Pleasure. Thank you.